Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most gracious, the most merciful. Here is the title of my presentation, How to Tackle Obesity in the Developing World, an Emerging Issue. I am Dr. Abdul Malik, Assistant Professor Pharmacology, College of Pharmacy, University of Sargodha. Now coming to the layout of my presentation, here is the list of contents: introduction, pathophysiology, complications, management and treatment options for obesity, non-pharmacological, pharmacological approaches, surgical methods, biological and technological methods are given. In the Quran, the Holy Quran, Allah says in the Holy Quran, Ya bani Adama khuzu zinatakum inda kulli masjidin wakulu washrabu wala tusrifu innahu la yuhibbul musrifin. O children of Adam, wear your beautiful apparel at every time and place of prayer. Eat and drink, but be not excessive. Indeed, he likes not those who commit excess. In chapter number 7, verse number 31. Now, coming to the metabolic syndrome, which is a major cause of many diseases. Metabolic syndrome is a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, increased blood sugar, excess body fat around the waist, and abdominal cholesterol or triglyceride levels have been increased. So these are the major factor which causes many diseases, that is metabolic syndrome. Obesity is the central point for metabolic syndrome. Now coming to the introduction of obesity. Obesity is a chronic metabolic disease characterized by an increase of body fat stores. Word is taken from the Latin obesus, meaning stout, fat, and having eaten until fat. It affects adults, children, and adolescents worldwide. Obesity causes cardiovascular problems, metabolic disorders, and some cancers. Obesity is serious chronic disease in both developing and developed countries. Now coming to other way, what are the major risk factors involved in obesity production, in induction of obesity? Obesity is a disease caused by genetic, environmental, and behavioral factors all contribute to its pathogenesis. The pathophysiology involves neuroendocrine factors involved in regulating both appetite and energy balance. Impairments in physical and physiologic functioning contribute to high rates of morbidity and mortality. Here are some given important points which you can see in the figure: physical activity, age of the menopause, sleep, psychiatric diseases, stress, socio-economic factors, and obesogenic environment, some medicine, drugs, parental factors, endocrine disturbances, and genetic factors and nutritional factors are there. Now coming to the epidemiology in world and in Pakistan. So we can see there is a main cause of energy imbalance between consumed and expended calories because of the current lifestyle. There is in world 1.9 billion people are overweight, with 650 million of those considered these. About 80% people develops diabetes. Obesity prevalence is high in women. overweight is more common in men. Overweight, obesity are fifth leading risk of global deaths. And in Pakistan, 22.1% are obese, 27.9% male, and 38.4% are females. Now, coming to the obesity in Pakistan, top 10 fattest countries in the world in which people are fat. USA is the first, China, India, Russia, Brazil, Mexico, Egypt, Germany. Ninth number is Pakistan and Indonesia. Classification of weight based on BMI and waist circumferences between comparison between the Europeans and Asians are given here in the table. You can see in first table we see the underweight in Asian people are less than 18.5. Normal range is 18.5 to 22.9. Overweight is above 23. At risk is 23 to 24.9. Obese class 1 is 25 to 29.9. And obese class 2 is more than 30. And the next waist circumference cut off points for Caucasian subjects are given below. Now coming to the pathogenesis, what are the major genes involved and other factors involved in the pathogenesis of obesity. So we see in factors involved in obesity are its etiology. Most of the factors you can see in this figure, obesity is established in non-genetic factors, which are 75%, lifestyle, environment, culture is 75% factor which are which induces obesity, and 25% are genetics. On the other hand, if we see on the figure, BMI, extreme obesity, which genes are involved with which causes obese extreme obesity is FTO, MC4R, PCSK1. These are the major genes, and some other genes also affect the pathogenesis of obesity. Now coming to the biomarkers, what are the major biomarkers involved in the obesity which you can check through serum level or other parts of the body. So here we see systemic inflammation is there, which causes multiple factors to increase or decrease in their levels in the body, in the blood. So in the obese person or obesity, adipose tissues releases some factors, and systemic inflammation in the adipokines also releases some factor. For example, if we see leptins are increased, resistin are increased, FABP4 is increased, and adiponectin are decreased, apelin hormone is decreased, omentin, that is in the intestine in stomach area, is also decreased. And further, these induces some cytokines which are dangerous, cytokines which are interleukin 6, interleukin 1 beta, TNF alpha, interferon gamma, which are induced. And further, these can also induce in the liver some other factors which causes increased CRP, C-reactive proteins, increased insulin levels, hyperinsulinemia, and increased triglyceridemia or triglycerides, and increased C-peptide that is released from the insulin secretion after the breakdown of the insulin. And you can see in the below, endothelial dysfunction is also shown here, and further these causes insulin resistance and some other diseases like cardiovascular problem or stroke. Now coming to the very important fat spillover, how fat spillover or ectopic fat go to other parts of the body. Major three fats are there in the body: subcutaneous fat, visceral fat, and retroperitoneal fats. If we see in the figure, in the front figure. So excess calories, increase intake, reduce energy expenditure, increases these storage areas, and after that overwhelmed, when these overwhelmed, these go to other parts of the body and spread the fats to other parts of the body. For example, if you see subcutaneous stores overwhelmed, there may be genes difference, ethnicity, and aging may affect, and fat spill out go towards the hepatic. Lipid accumulation will happen, and this also causes multiple diseases. And in skeletal muscles, there is also fat spill out, and in pancreatic beta cells, these also increases the fats, and in the perivascular fat, endothelial dysfunction, altered blood flow is there, and these factors multiply and form the insulin resistance and creates insulin resistance and beta cell dysfunction and hyperglycemia, which is symptoms of the diabetes type 2. Now coming to another slide, which is involved about the microbiota. Microbiota, which is the normal flora of the body. After obesity, or there is a patient with obese, there is increased level of changed microorganism in the body, which induces inflammation. You can see inflammation that can change the fat deposition, and that can change the insulin resistance, and further these causes obesity and metabolic diseases. So microbiota, normal flora of the body, if in the people of the obese patient changed into another form and causes multiple diseases, including diabetes or obesity. Now coming to this one, high fructose intake, that is fructose commonly was taken in Americans, that was considered that is safe, but nowadays has been checked that fructose causes multiple problems and insulin resistance and diabetes through different pathways, different factors, inducing different factors. You can see in the table in the figure that lipogenesis, dyslipidemia has increased, which increases the ectopic fat, lipid metabolites are also increased, and increases body fat, intra-abdominal fat are also increased by fructose. Reactive oxygen species are also increased, and hyperuricemia, which causes further vasodilatation or impaired endothelial dysfunction and insulin resistance, and further insulin resistant causes diabetes mellitus type 2. Now coming to another slide, which is very important, that in high intake of sugar and sugar products and fast foods also causes the problem of obesity or obese. So these should be avoided for the obese person, and the normal person should be avoided. Now, medical complications of obesity, that is very essential, very important. What are the major complications? More than 50 complications are there. Obesity is a root cause of multiple diseases. More than 50 diseases are derived from the obesity, in which some of them are given here, including the coronary heart diseases. For example, if we see diabetes, dyslipidemia, hypertension is there, severe pancreatitis, cancers, phlebitis, gout, skin diseases, osteoarthritis, gynecological abnormalities, gallbladder diseases, non-alcoholic fatty liver disease, pulmonary diseases, and some stroke, cataracts, and some other causes are idiopathic intracranial hypertension, you can see in the figure. Now, another part that is very essential, very important to treat, to manage obesity, which are the factors, which are the things we have to understand and manage the obese persons, obese patients. So, current research options can be grouped into followings: algorithms for assessment and stepwise management is there, diet and supplements should be there, physical exercise, behavior therapy, non-pharmacological treatments, pharmacological therapy and stop the regain of the weight, surgical or bariatric or metabolic surgery therapies are there, novel targets, biological and technological methods through devices are also given. Now here is the slide with 5 A's provide a useful method. For example, A for ask, discuss weight with the patient. 5 A's mean 5 A's. First is ask, discuss the weight with the patient. Number 2 is assess healthy status, comorbidities and causes of the weight gain. Number 3, advise on treatment options. Number 4, agree on weight loss expectations and treatment plan. And number 5, assess the patient in the continuous process of weight management. These are given here in the figure. Now non-pharmacological classification of some methods or treatment methods or approaches are there. For example, lifestyle modification is the first priority, first method that can be used for obese person or obesity to reduce the weight. And second is endurance exercise. And third option, you can apply ketogenic diet in which fatty food can be taken. Nutrigenomics and nutraceuticals should be checked for that person, specifically for that person, which is should be used for that patient. Blood groups can also be checked for non-pharmacological classification. Herbs and herbal formulations, vitamin D exposure or supplements, stop smoking or quit smoking, stop weight gain medications if that is increasing. For example, antipsychotic drugs are increases the weight gain. So sitting into some diabetic drugs also increases the weight. Sitting 2 hours in cold at 17 centigrade also reduces the obesity. Lifestyle related to circadian disruption can increase risk of type 2 diabetes and obesity. So here is the lifestyle modification. How can we change the lifestyle? With the help of healthy food, we can change the lifestyle. Healthy lifestyle is in which diet or supplements like vitamin D and some other supplements should be maintained, while exercise on daily basis to tackle the obesity or this disease. Now diet plan for weight loss is essential and given in 2 languages. First is in English and in Urdu. You can see from both sides and what are the major things you have to take. There is a gaps between the meal and there is a meal timing and meal you have to eat in different times. For example, for breakfast, 2 slices of brown bread or 1 boiled egg without yolk, 2 egg whites or 1 omelette or of 2 eggs white, 1 cup black coffee or 1 cup tea without sugar. Mid morning, if we see 1 cup of mixed fruit, apple, guava, pear, peach, and in the lunch time you can see that is 2 to 4, 1 cup salad, broccoli, cucumber, tomato, carrot, radish, olives, lemon squeeze, 1 chapati, 2 small pieces of chicken, fish, half plate or curry, vegetable, dal cooked in oil. Evening snack 5 to 6, 1 homemade sandwich or 1 cup green tea, lemon with honey. Dinner 7 to 8 time, 1 plate boiled rice, 1 cup vegetable soup without corn flour, and bedtime 10 to 11, 1 cup milk without sugar. So these are the things. Drink 10 to 12 glasses of water daily. Avoid fatty food items like pizza, burger, cold drinks. Do brisk walk daily about 30 to 45 minutes. These are the major things you can see, but there may be some variation in some other diets. Now coming to the physical exercise, that is very essential part in some research that has shown that irisin is released during exercise, and if rats uses physical exercise during any food intake, that microbiota will be fine, good for the healthy lifestyle. And researchers found rats that exercised developed different gut microbes despite eating the exact same amount of food as sedentary rats with unlimited food access. So, what are the major things we have to see? Number one is ketogenic diet. Ketogenic diet can be used to reduce obesity, and you can see ketogenic diet is given in below, which contains eggs, dry fruits, fats, and butter, some other avocado, and coffee or green tea. On the other hand, if you see, high fructose corn syrup also causes high energy, and that is high dense food that should be avoided. And the other hand, if we see the salad or healthy salad or vegetables are given that can be used, these have low dense food, these are low dense food basically. On the other hand, if we see in the right, chips are there, this is high dense food having high energy, and high dense foods like chips are those with high fat and high energy, while low dense foods are like salad and some other things that can be used. Now, what are the behavioral interventions? Behavioral intervention include behavioral intervention highlights to avoid night eating. Night eating should be avoided. Breakfast skipping should be avoided. Sleep restriction should be avoided. Sleep fragmentation should be avoided. High fat diet should be avoided, and eating 3 times a day meal, that is gap between 4 to 6 hours, a better one in multiple research reports, which may save us from obesity and type 2 diabetes. When you eat is as important as what you eat. So these are the things we should understand about the behavior. Now we see the plants and polyherbal formulation can be used for obesity. Many plants and formulations have shown anti-obesity activities, including Trigonella phoenum graecum, Gemnima sylvester, Psychorium antibus, Nigella stava, polyherbal formulations including Pol 4, Pol 10, OB6, Diazoline, PDBT. These are the pills available which can be used for obesity, diabetes, and associated cardiovascular problems. Now coming to we check the plants in Pol 4, which are the given here. 4 major plants are combined which can be used for obesity, for diabetes, and associated cardiovascular problem, in which it includes Trigonella phoenum graecum, Methidana, and second is Gemnima sylvester, Gurmar, Putti, and third one is Psychorium intybus, Tokhme kasni, and Nigella stava or Kalwanji are given here. Now pharmacological approaches. Currently available pharmacological approaches are responsible to reduce weight by 3% to 9% compared with lifestyle therapy alone, but are associated with unfavorable side effects. Future targets include leptin, ghrelin, peptide YY, semaglutide, tesofenacin, T3 triiodothyronine, beta 3 receptor agonist are given for the reduction of the obesity. Now weight loss medication past, present, and future, that is given here in this table. You can see from this table weight loss medication past, present, or current and future. Withdrawn medications that are given in the start, which are fenfluramine, dexfluramine, phenylpropanolamine, rimonabant, sibutramine. These have been reduced or withdrawn due to having some serious adverse effects. You can see cardiac valvular insufficiency, hemorrhagic stroke, depression and suicidal ideation, non-fatal myocardial infarctions, and some other cases. Due to these reasons, these have been withdrawn. Now coming to the current situation or current therapies, in which phentermine being used from 1959 to up till now, palpitation and elevated blood pressure is there, that is side effect. Orlistat from 1999 to up till now has been used, and that causes the liver injury. Phase 3 trials can be used for the obesity application to FDA, EMA, lorcaserin, bupropion, naltrexone, topiramate, phentermine, and GLP-1 analogs. These have some less potential side effects, like GLP-1 analogs have pancreatitis, and toparamates and other are having depression, suicidal ideation, cardiovascular events, memory loss, and birth problems. And if we see the bupropion and naltrexone, seizures, palpitation, and transient blood pressure elevations are there. Lorcaserin, that contains potential valvular heart diseases. So these are the things, drugs which are being used and have been used earlier. These are the new techniques. New skin patches can reduce obesity. This research has been taken from the Singapore, in which scientists from NTU University Singapore team identified two drug types known to oxidize fat or help control metabolic and digestive functions of the body. One drug is the beta 3 adrenergic receptor agonists, mirabegron beta 3 drug, that is tests with lab mice and in some cases humans increase fat oxidation and energy expenditure, showing promise to help control weight. Another drug, that is hormone T3 triiodothyronine, produced by the thyroid gland, also helps control a number of functions including metabolism and digestion. Here is the skin patch mechanism. How skin patch works and how it is applied in the body, what are its mechanism, skin patch size and procedure and mechanism of its effectiveness for obesity is given in this figure. About the patch, you can see 1 centimeter is in the actual size of the patch, 1 centimeter length, 1 centimeter in width, that is attached in the body, in the belly, in the accumulation of subcutaneous white fat that is converted into brown fat. This is the mechanism given in 4 points. You can easily understand how it works. Now, skin patch trial have been done in Singapore with the obese person have been kept in the trial to check the effectiveness of this skin patch. Now, coming to the bariatric or surgical method for weight loss, in which stomach or small intestine portion is cut down to restrict absorption of food. Weight loss surgery involving gastric bypass are collectively known as bariatric surgery. It involves making changes in digestive system to help losing weight. So first is malabsorptive procedures, Roaxin Y gastric bypass, RYGB, biliopancreatic diversion, BPD, restrictive procedure including gastric banding, vertical banded gastroplasty, VBG, and jejunal bypass. You can see with the help of figure how Roaxin gastric bypass is being made or cut from the stomach and intestine. Here is the vertical banded gastroplasty, and in the third case, adjustable gastric band that is attached with the fundus area of the stomach that is closed, and the biliopancreatic diversion with duodenal switch is also shown in this figure. So these are the major four surgical methods that can be used. Now coming to the biological methods, CRISPR-Cas methods are gene therapy, which is under clinical trial to replace the bad genes or obesogenic gene with new healthy gene. Procedure is given here. You can see CRISPR-Cas9 that can work and replace the gene with newer one, and gene therapy also help in this case. Very important, circadian regulation of energy in humans. This is very essential. Circadian rhythm is normally regulated by control central and peripheral clocks, but if there happened misalignment, then obesity, diabetes, and some other diseases can happen, or sleep problem can be developed, which we should reduce and set sleep meal timing with circadian clocks. So if we see if the left side of the figure in the blue area, that is peripheral clocks, and the red is central clock that is present in the brain. Suprachiasmatic nucleus is there in the brain that control the central clock. Melatonin is there in pineal gland, and in the peripheral clock that we intake our food, we sleep, we do our work, daily life, that is peripheral clocks. How our body works, how our digestive system works, how blood is formed in the bone marrow and other cases, these are the normal. Circadian alignment is there. If there is a misalignment in circadian rhythm, then there is, as you can see, central clock is on the different way and the peripheral clock is on the different way. So this can cause multiple diseases, including obesity, diabetes, cardiovascular problem, sleep disorder, and some other diseases. Fecal microbiome exchange method, in which cell metabolism, improvement of insulin sensitivity. In this case, healthy persons' feces were exchanged with obese or mild metabolic disease persons. Much improvement has been shown by this study. In this study, if we see the title of this study, improvement of insulin sensitivity after lean donor feces in metabolic disease syndrome is driven by baseline intestinal microbiota composition. So these are the things. If normal feces, healthy feces are exchanged with the obese person feces, then obese person can reduce to normal lean or come back to normal weight. Now coming to the technological method, these are very essential, very important, using artificial intelligence, different robots and different devices can be used. Artificial intelligence is a future targets or need of the world in management or surgical methods or in devices. You can see in surgically, you can see here is the Vblock. Vblock is the vagal nerve block device that is attached outside the skin for the purpose to stop the vagal activity that enhances the food intake. If we stop this one, then food intake will be reduced and the obesity will also be reduced. Vblock is attached over the stomach area of the skin, which block the vagal nerve, 10th cranial nerve, very parasympathetic nerve. In this case, patient do not eat much food due to vagal block. Now coming to another method, that is aspire assist method. This is very important non-surgical method, FDA approved method, of weight loss device that allows patient to empty a portion of their stomach contents after eating to facilitate weight loss. These are the non-surgical seven methods are there. One of the method is aspire assist method. So in this case, after eating, the person removes some of the food eaten from the stomach to the gutter, to the other outside of the area. Now in balloon therapy, this is again new coming method in balloon therapy. Intragastric balloon placement is a weight loss procedure that involve placing a silicone balloon in your stomach. This helps you lose weight by limiting how much you can eat and making you feel fuller faster. So these are the methods. Single one balloon method is there and two balloon methods are also there. These are entered through oral cavity and sent to the stomach, and further these are opened in the stomach area, and food content will be taken very low. Now endo barrier gastrointestinal sleeve method, that is endo barrier is a medical device for the treatment of type 2 diabetes and obesity which is worn inside of the body. This is plastic sleeve which lines first 60 centimeter of the small intestine, causing food to be absorbed further down to in the intestine. In this case, in this way, the absorption of some food material has been restricted, and the obesity cases, there is a reduction in obese person. In the last slide, which is very essential, very important, obesity and fitness monitoring system, architecture of smart system for obesity control, in which use objective techniques, use current wearable or body fixed body sensors are attached with the person, which include switches, pedometers, ectometers, goniometers, accelerometers, and gyroscopes, video recording system, optical systems, and mechanical systems for assessing physical activity, food intake, sedentary time. So these are the things. Many applications are being used for obese patient. In this case, there is used Wi-Fi has been used, or GPRS has been used, which connects with the hospital, with the doctor, with the patient web platform, which quickly informs all the possibilities, all the risks, all the benefits of the patient. So here is the acknowledgements and collaborations. That is College of Pharmacy, University of Sargodha, Professor Dr. Muhammad Shuaib Akhtar, Professor Dr. Sajid Bashir, and from the Government College, University Faisalabad, Dr. Malik Hassan Mahmood, and from Haripur University, Haripur, Professor Dr. Anwarul Hassan Gilani, and from FC College, University Lahore, Dr. Hafiz Mazhar Asjad also helped and has been collaborated. And here is my picture in Aga Khan University, Karachi, where I have worked with the collaboration and my title was diabetes, obesity, and cardiovascular problem in different with the different plants. So if you have any questions, you can ask or write in the comments box in the YouTube channel, and I shall try to answer all of those questions. Thank you. God bless you. Allah Hafiz.